Something says,
There it goes.
hi, good afternoon or good noontime.
Yeah.
It's nice to see everyone, and welcome to the Partnership at Drug Free New Hampshire's National Prevention Week Facebook Live series. We have invited prevention professionals from a variety of roles across the state to share their prevention story, their expertise, and their experience strengthening community, building resilience, and creating hope. I'm Julie Yerkes, and I'm the Community Engagement Director at the Partnership at Drug Free New Hampshire. And I'm really happy to have Jennifer Sabin with us today, the Suicide Prevention Coordinator at the New Hampshire Department of Health and Services, and Jody Langelotti. How'd I do, Jody? Yeah. From OCD New Hampshire and the Dover Mental Health Alliance. And they're here today for National Prevention Week theme of the day, preventing suicide. Everyone plays a role. And I'm really glad that you could spend a little time with us today. Welcome.
Happy to be here. Thanks.
Thanks. So Jennifer, you know, your role as State Suicide Prevention Coordinator is just over a year old.
Yep.
Could you speak, suicide has been at the forefront of our work in prevention, in a public health concern for quite a while. Can you speak to why, what rose to the level of importance for the state to create a coordinator position?
So you're right. I was hired in March of 2021 to do this role. And it really is the result of a number of years of advocacy from our prevention partners to say, it's great that we focused on this, but we really need one state position that's completely focused just on preventing suicide. So when the recommendations came forward from the 10-year mental health plan that included the renewed efforts around suicide prevention, lots of advocates made the recommendation to say, you're saying in your own plan, DHHS, that you need to focus on this. Having that coordinator in that position is really going to be one of the ways that we really move that work forward. And so a position was created and funded through general funds in New Hampshire, which is really exciting. Part of what is really interesting is that a number of our neighboring states and other places across the country have had someone focused on suicide prevention. And so if you look at, our partners in Massachusetts who have had this position, we can sort of look to them to see what's coming for us, which is really exciting. And when you put that kind of focus on, just how much you can double down on efforts that are already happening, right? So New Hampshire was already focused largely on mental health and substance use broadly. And so when you bring that real specific focus and content expertise when it comes to suicide, you really can just expand the deep impact as you really integrate it into this public health approach, which is sort of right on with everything built in my role. So it's really exciting.
Great, thank you. So you spoke about a plan, the state mental health plan and the suicide prevention plan. What are the priorities in that plan?
Yeah, great point. I'll just back up for just a second, though, and just say that sometimes when we're talking about suicide, it can start to feel really overwhelming for folks. And so because so many of us have been deeply impacted by this issue, if that happens to be you, if you're listening and you're like, wow, this subject is just a lot. I sort of thought I was interested, but now it's feeling like too much. You can reach out to the Crisis Text Line, which is a great national partner of ours. You can either text them directly from your smartphone at 741-741, or you can actually hop right on Facebook Messenger and chat with them via Facebook, if that's how you're viewing us right now. The other thing you could do either now, if you're feeling overwhelmed, or later in the day, if it just is like, wow, that felt heavy, is to call the New Hampshire Rapid Response Access Point. And they're available via phone or text at 833-710-6477. I'm even not immune to that, right? This is my whole job. And I use those resources because the content is just sometimes too much. So even though we're really focused on all of the awesome things that are happening in the state, it can still feel really overwhelming sometimes. So just wanted to sort of back up and say that. But as far as the plan is concerned, there is really exciting work. So There is a state prevention plan for suicide prevention that was released in 2021 and goes through 2024. It does have two broad goals. Goal one is really around promoting awareness that suicide is a public health problem and is generally preventable. And goal two is around reducing stigma associated with getting services for mental health, substance use, and suicide prevention. And so the plan then breaks down into various goals and objectives and strategies that really move the target on those two overarching goals. And it really fits with this sort of theme and drive of everyone plays a role, because there are a number of things that we can do in our own personal lives and in our professional lives to really promote that awareness and reduce stigma, right? So like even me just saying, hey, sometimes I get overwhelmed when I talk about suicide too. That's a stigma reduction strategy, because I'm not going to sit here as the state prevention coordinator and make you all think that this doesn't also deeply impact me in a personal way. I lost my friend Sue to suicide in 2014. This is a personal thing for me as well. And so anytime that we sort of have that platform to normalize the fact that sometimes we're all not okay, that is directly tied to the strategic plan. So sometimes there are plans that really feel like they sit in a binder or sit on a shelf. And what we're really trying to do with the Suicide Prevention Council and with my position is say, it's all of our work every day and every moment that we have it. And that can be really empowering for folks in the community who really want to make a difference.
Thank you. Yes, when I think state plan, I think big, right? I think out of reach, not something I can do, not something I can chip away at, and my own daily activities. And you know, you just mentioned one strategy, just being able to normalize uncomfortable feelings, being able to talk about it, saying how we can each, you know, use the resources that are available. Can you share with us some other, you know, strategies that you're aware of? That you know resources for that we could all be you know using and do, you know, to increase awareness and to decrease stigma.
Yeah, for sure. So one of the main ways that the Suicide Prevention Council, which is a legislatively mandated cross-sector partnership that meets every other month, has various committees that meet on an ongoing basis and have work plans that really drive up to those goals. And so for folks who are really looking for a way to get more involved, joining the council and one of its committees is an awesome way to do that. They're always looking for more people, more diverse experience to get involved with those. One of the other things that folks may have heard about is something called the Eye Care campaign, which DHHS rolled out with the council as well as in partnership with the regional public health networks. And so there's actually a number of events that are sort of popping up all over the place, where that's really a behavioral health marketing campaign that's focused on hope and help seeking and connecting with each other. And so, you know, when we really think about sort of primary prevention, right, in the primary prevention world, is long before a time of crisis, just sort of checking in with yourself and checking in with other people, asking for help when you need it, and then knowing where to find that help is good prevention all around for suicide prevention and the like. And so that's another way that we're really working on that stigma reduction, to just say, especially during COVID, you know, we've been able to talk a little bit more about not being okay and feeling overwhelmed, and anxiety and depression just sort of really ramping up, especially with young people. And so anytime that you're sort of checking in with yourself or checking in with anyone else, it really does have that overarching stigma reduction. And then there's some actual marketing campaign materials and social media posts. And so, you know, if you want to be able to reach out to other people and know that, you know, you're a safe person to say, hey, I'm having a hard day, I'm not okay over here, we have some example posts that you can just sort of post on your own to say, I want to check in, I want to make sure my people are okay. And that's another way to do it.
Great, that's great. So I heard we can join the council, and the website for that, or some of the work groups in the council, and the website was just posted in the comments. You can also look at the Eye Care campaign materials and explore those and how to implement those. And you can always contact the partnership at Drug Free New Hampshire to kind of think about and strategically think about how to implement those types of campaigns. And I also know that you can reach out to Jennifer as well. And then that practice of checking in with yourself and checking in with others and being knowledgeable about the resources that are available. Which brings me to Jody. I really wanted to touch base with Jody because I know Jody has done a lot of work individually and with groups of people to really do that primary prevention, right? That earlier on. And, we hear this a lot that, that mental health resources are limited. There aren't enough. We've heard it, in each of our interviews this week and conversations. I, will be, like what Jennifer did, truly open. I was on psychologytoday.com today, sending many emails, looking to see if there are openings for family members. And it's hard, it's hard to find. There's not a lot of openings. We've heard about crisis beds being full. So not to dwell on, but what can we do? The idea of prevent, having access earlier, right? Being able to prevent crisis, being able to check in earlier. How can we do that? What are some, what would you suggest? What are some things that we can all do after listening to this?
Well, thank you so much, Julie. And it's important to remember that 1 in 5 of us will be diagnosed with a mental illness or disorder in our lifetime. And 5 out of 5 of us are going to either previously, now, or in the future have a mental health challenge. We all can struggle with mental health at times. And as we've mentioned and talked about here, we have kind of these concepts of prevention. And often we're thinking kind of up, further down the stream prevention where the problems happened and we're trying to keep it from happening again. But really, if we can try to start to address it before the problem really happens, before somebody gets into crisis, number one, the sooner we can help them connect with the appropriate professional help, the better the overall recovery and outcome. But we know that those resources are very limited. So there are 3 very specific things that I think we can all do that would allow us to better help ourselves, better help our friends, our family, our colleagues, our coworkers, and in general, our community. And the first is to educate yourself. There's so many amazing free trainings that are being offered through various organizations across the state. The first is mental health first aid. There's adult mental health first aid, which is for adults to help other adults who might be facing emotional distress and mental health challenges. And it's really about recognizing signs and symptoms. You're not going to be able to diagnose someone. That's not the point. The point is to recognize signs and symptoms, to learn some language that you could use when having these conversations with people, specifically around suicide prevention, how we can reduce stigma by choosing our words, someone who's died by suicide, and also when we're speaking to somebody about suicide, how do we ask in a direct way? And again, please make sure that you're using the resources that were mentioned earlier. This is a very heavy subject and it's hard to talk about for sure. So there's mental health first aid for adults. There's mental health first aid for youth, but it's actually adults working with youth. And then there's also teen mental health first aid, which some schools around the state are starting to implement into their curriculum. Dover is one of them. All sophomores, it's anyone taking health, but generally that's a sophomore level class. And 10th grade is the youngest that this course is able to be taught, are learning these skills and how to recognize signs and symptoms in their peers and then help them get the appropriate help. Other forms of education are the NAMI Connect suicide prevention training. And we're going to have a great link for you in the comments here that goes to a wonderful webinar that is posted on their website that goes over the kind of foundation and basics of suicide prevention and awareness. Really important information. And these trainings are being offered through NAMI New Hampshire. They're being offered through the Dover Mental Health Alliance if you're local to Dover. And again, there's other resources around the state where we can receive these trainings. And educating yourself is really important. The language we use matters. But also, the number 2 thing we can do is get comfortable being uncomfortable. It is hard to have these conversations. It's hard to admit that we need help. And often when we're uncomfortable, a function of our brains is to push it away. We don't want to deal with it. We don't want to talk about it. And it's a self-preservation technique that actually comes from, way back when, hunter-gatherer days, if you will. So if we educate ourselves, we learn a little bit more about the language we could use. It can help us deal with that feeling of being uncomfortable when we're going to approach somebody to have this conversation. Oftentimes we might see that somebody is not doing great, but we don't want to bother them. We don't want to, say something to upset them. And so oftentimes we might just let it go and we might not say something. But in reality, when we see something, we need to say something. And that's the third thing that we can do. Whenever we see something, say something. And it can be something as simple as, hey, Julie, I've noticed that you seem to not be yourself lately. How are you doing? I'm a little concerned for you. Just something that simple. Hey, I've noticed. And then, I'm here for you. Do you want to talk? How can I help? When someone feels heard and seen, they are more likely to seek help and less likely to continue to retreat, because we all just want to feel valuable, feel seen, feel heard. And we often feel very, very alone when we're struggling with our mental health. And so when someone notices, it helps us realize that we're not alone, that there are people who care. And you don't have to have the answers. I would highly encourage you to take note of the resources that we've mentioned in the comments, specifically those crisis lines. Have those, save them in your phone. Save them in your phone. So if you're having a conversation with someone, you open the door and say, hey, I've noticed you seem to be off lately. How are you? How can I help? You have those numbers available if needed, but you don't have to have the answers. The goal is to say something and then to try to help connect that person to help. And one of the things that you can learn through the trainings, especially because we talked about the fact that there's long wait times for clinicians and things like that, there are other programs and people that we might be able to seek for help for ourselves or recommend or offer as options to the people we might be talking to. And these can be community organizations. It could be playing basketball at the rec center. It could be a knitting club. It could be a book club. Just different things that help us connect with the community. And then there's also a large assortment of support groups that are available either virtually or maybe some are going to start to go back in person. Everything from, if you have anxious children, if you're anxious yourself, if you're struggling with depression, or if you're struggling with substance use, or if you've lost someone to suicide. So there's a lot of different resources out there. So to recap, because I know I said a lot in a very short period of time, but number one, let's educate ourselves as best as we can. Some great free resources that are available. Secondly, we have to get more comfortable being uncomfortable and realize that these are never easy conversations, but they're oh so important. It really is okay to not be okay. And then third, when we see something, we really need to say something. Even again, just something as simple as, hey, I've noticed, how are you? And just trying to open that door to conversation.
That's wonderful. Thank you, Jody. That's great. And I was going to recap for you, but thank you for doing it. And I think that that process of educating yourself is connected with that being comfortable, being uncomfortable, right? Because at the beginning, it can be really uncomfortable. But it gives, over time, the more you learn, the more language and I took that youth mental health first aid class for professional reasons. And I realized immediately how applicable it was in my personal life, and how I was telling everyone about it. And then I became so much more comfortable with the language and they became more comfortable talking about it. And now we have a community where we can be talking about how we're supporting each other and each other's children. And it's just starting that people felt alone before, and it's like, no, it's tough. Adolescence is tough. Kids have a hard time, and then really those last few years. So thank you for that. And then I think once you become really comfortable, then you sort of get to Jennifer's level where you're engaging in the work groups at the council and you're using the iCare campaign, right? And it's these building blocks of engagement where we can all be playing a role in this. So I appreciate all the resources that you've brought up. They're in the chat. You can reach out to, may I offer this, any of us?
Yeah, of course.
Through the partnership, and Jody through OCD New Hampshire, that is in the chat, and Jennifer at the New Hampshire Suicide Council.
Yep.
Any questions from our listeners or anything in there, or any other comments, Jennifer, that maybe you have?
Yeah, no, the only other thing I'll add, Jody made a great point about saving those numbers in your phone, right? Making them easily accessible. The other thing that I'll say is you can reach out to them not when you're in crisis, right? I know that we say like crisis line, and a lot of people can be like, well, I'm not in crisis, so I don't think that thing is for me. But what we also know about behavior is if you interact with something when you're not in crisis, you're more likely to use it if you're familiar with it when you are in crisis. And so text the crisis text line right now, jump on Messenger and just say, hey, I heard about you on a live stream. I have no idea what this is. And they'll be able to explain their service to you. And when you build that sort of comfort level, when you get that first time out of the way, if you need it for a different reason, it makes it that much more comfortable. And so you don't have to wait until you're in sort of this really crisis state to reach out to the Suicide Prevention Lifeline, to the Access Point, to Crisis Text Line, to any of these resources, right? You can do it long before the time of crisis. And if you're not experiencing thoughts of suicide, you can still reach out. A lot of times people are reaching out because they're concerned about someone that they care deeply for and they don't know what to do, right? So this idea that you're noticing something different in someone that you care for and you're not sure how to approach it, that's a perfect text to send a rapid response, to say, I'm worried about my friend, my brother, my mom, myself. I don't know what to do. And just let them take it from there. And the more that you interact with those services, the more comfortable you can get. And then you can really feel good recommending and referring other people when you've experienced it yourself, right? When we first launched Rapid Response, which is new this year in New Hampshire, I was testing it all the time because I'm not going to give people a phone number that I haven't used and seen and really felt. So it's really important as community members, as people who care about prevention, to utilize these resources so that we can continue to improve them and have them really widespread for our communities.
That's a really great point. Absolutely. You get comfortable with it, then you feel comfortable recommending it, right? I had a resource once that I was recommending. I was like, I better test that out. And now I can say, so first you're going to talk to this person and then they're going to refer, like now I know the process. And so it's so much, I can say that when I recommend the resource, right?
Exactly.
So having that experience. Well, thank you both very much. We really appreciate your expertise and your experience in sharing what you have. Listeners, don't forget to, check out the resources. Feel free to reach out to any of us and visit the partnership at Drug Free New Hampshire for comprehensive resources. Thank you.
Thank you.
Have a great day.